In the case against neutering, most of the evidence for the prosecution was collected and presented by researchers from the University of California, Davis. 5 similar papers from one research team form the basis of a campaign to delay dog neutering until at least 2 years or abolish it entirely. Now, the methods reported in each study are similar, so the variable is breed. Now, the first study assessed golden retrievers and subsequent studies compared them with other breeds. The research culminated in a pair of similar studies, both published in 2020. One concerned mixed breed dogs and the other focused on 35 pure breed dogs. Now, it's this study which garnered most press coverage, so I'll focus most of my attention here. Now, neutered female golden retrievers were singled out by the University of California researchers as especially vulnerable to cancer. And they cautioned that female golden retrievers who were neutered before the age of 1 were 7% more likely to develop cancer. And their stark conclusion makes neutering female goldies seem like a dangerous choice. I quote, "The suggested guideline for females, based on the increased occurrence of cancers at all spaying ages, is leaving the female intact or spaying at 1 year and remaining vigilant for the cancers." But this conclusion is extremely misleading. Another research group used data from the same university teaching hospital to show that neutered female golden retrievers live on average 3.5 years longer than intact females. It's a fact that cancer risk increases in proportion to lifespan, so it's entirely predictable that neutered goldies with their dramatically longer lifespan are significantly more likely to develop cancer. Mammary cancer is particularly important because it's the most common malignant cancer in female dogs as well as in humans. Now, one of the most durable statistics about the relationship between female hormones and mammary cancer comes from this 1970 study, which was published in the prestigious journal Cancer. Now, risk in dogs was significantly decreased by early neutering, and that's illustrated by an increasing risk of developing mammary tumours depending on whether neutering is performed before the first estrus, which is 0.5%, before the second estrus, 8%, or any subsequent estrus, 26%. But this study's older than me, and over the past 50 years there's been a lot more research on this important subject. Now, that's in part because understanding the relationship between sex hormones and mammary cancer in dogs might help researchers fighting human breast cancer. Now, about 80% of breast cancers are estrogen receptor positive. So a relationship between an intervention which lowers estrogen and lower cancer risk is intuitive. Now, the prevailing belief in human healthcare is that risk of developing breast cancer is influenced by cumulative exposure of breast tissue to estrogen. But the finding that estrogen-only hormone replacement therapy can reduce breast cancer risk highlights the complexity of the interaction between hormones and the body. So if you're a pet owner who doesn't want to neuter your dog, you'll probably seek out evidence to support this choice, and you'll find it. Anyone who comes across this 2012 systematic review will learn that of 13 reports addressing the association between neutering and mammary cancer, 9 have a high risk of bias and 4 have a moderate risk of bias. So I quote, "Due to the limited evidence available and the high risk of bias in the published results, the evidence that neutering reduces the risk of mammary neoplasia and the evidence that age at neutering has an effect are judged to be weak and are not a sound basis for firm recommendations." Now, a pet owner could choose to stop doing their research at this stage. After all, they found the evidence they were after. Or they could dig a little deeper and find other studies, including this one, which supports a strong correlation between neutering and a reduced risk of mammary cancer. No discussion about the relationship between hormones and cancer is complete without considering body fat. Now, it produces hormones and inflammatory chemicals that can trigger cancer. Excess body fat in particular can lead to chronic low-grade inflammation, which is a known risk factor for cancer. Now, in humans, excess body fat significantly increases the risk of at least 13 types of cancer, including breast cancer in women and colorectal cancer in men. Now, in dogs, excess body fat is also linked to cancer. For example, overweight female dogs are significantly more likely to develop mammary cancer relatively earlier in life, and they're more likely to suffer from metastatic mammary cancer. So in summary, although some studies suggest that neutering might increase the risk of some cancers, this can be explained either partially or entirely by the longer lifespan of neutered dogs. But unlike neutering, being overweight has no health benefits. It increases cancer risk and it shortens lifespan. And this is why keeping our dogs lean must be our top priority.